Welcome to Medicomp. We have been advancing diagnostic cardiology since 1981. Our goal at Medicomp is to provide the best telemedicine solutions for healthcare professionals and their patients. To achieve that goal, Medicomp presents a training guide for medical staff on the CardioPAL SAVI event monitor. This video will take you step by step through the process of setting up Medicomp's CardioPAL SAVI event monitor for a patient monitoring procedure. This video will focus on the standard CardioPAL SAVI event monitor setup. Complete and more detailed information is available in the CardioPAL SAVI User's Guide CD. The SAVI monitor allows the patient to capture their ECG recording if they feel a symptom. The SAVI is unique because it is also equipped with onboard artificial intelligence and an auto capture feature. This allows the monitor to automatically capture cardiac events, even if the patient doesn't feel them and press the symptom button. The training program is divided into 3 sections. Section 1 covers the SAVI kit contents, an overview description of the SAVI, and preparing patient enrollment forms. Section 2 covers hooking up the SAVI event monitor to the patient, installing a new battery in the SAVI, operating modes, and transmitting a baseline ECG to Medicomp's Cardiac Monitoring Center. And Section 3 demonstrates the procedure for accessing patient data and retrieving patient reports on the computer. Section 1. SAVI Kit Contents. The SAVI kit contains the following items: Patient Guide, SAVI Monitor, Patient Cable, Electrodes, AA batteries, Lanyard, Patient Survey, and a prepaid shipping envelope. SAVI Overview. The patient will wear the SAVI for the prescribed procedure length. The SAVI is pager-sized and very lightweight. It has 3 buttons: an LCD display for technician and/or patient interaction, and an optional finger electrode accessory. If the patient feels a symptom, they simply press the button marked Symptom. The display shows a countdown message while the recording takes place. The Yes button is used for technician interaction during patient setup, and used by the patient to transmit ECG strips to the Medicomp CMC. The No button is sometimes used during setup, and only used by the patient when instructed by a cardiac monitoring center technician. The display shows monitoring with the current date and time, while the procedure is running in auto capture mode, also called the auto looper mode. When in the manual looper mode, meaning the auto capture feature is turned off, the display shows Ready with the current date and time. The connector on the top of the unit is where the patient cable plugs into the SAVI. The optional finger electrode accessory is used when the patient cannot tolerate wearing the electrodes and plugs into the same connector as the patient cable. The display is blank in this mode until the symptom button is pressed. The SAVI attaches to the patient using the belt clip located on the back of the unit, or by using the lanyard. Depending on which SAVI model you have, the battery compartment is located either on the left side or in the back. The monitor uses a single AA alkaline battery. Complete information on installing a new battery will be covered later in this video. Preparing patient enrollment forms. When preparing patient enrollment forms, you have 2 options. Option 1, the traditional paper enrollment form. Please be sure to include patient name, medical records number, demographics, and insurance information. You can enter the insurance information on the enrollment form or fax a copy of both sides of the patient's insurance card along with the patient enrollment form to Medicomp's Cardiac Monitoring Center at 1-888-340-4430.
Start transmission.
Option 2. Use Medicomp's Web Enroll on the Arrhythmia Access website at www.medicompinc.com. To ensure greater accuracy, we recommend Web Enroll because there can be variations in the quality of fax transmissions in addition to difficulty in reading handwriting. Log in by clicking the Arrhythmia Access icon on the Medicomp home page. The Welcome to the Arrhythmia Access portal page will come up and advise you of any updates or alerts. Click on Patient Enrollment and then click on Event. Complete the form ensuring that you have included the insurance information, particularly the insurance company name, group claims number, policy number, and name and address of the subscriber. Then click on the Submit Enrollment button at the bottom of the screen. Required fields are marked with a red asterisk. Your patient is now enrolled at Medicomp's Cardiac Monitoring Center. Whether you enroll your patient via fax or on the web, a SAVI kit to replace the one you are about to use will automatically be sent to your facility. Section 2. Patient Hookup.
Hi, Mr. Jones. How are you today?
Very good. It's nice to see you.
Nice to see you. I have your 30-day event monitor here.
Okay.
And I'm going to help you get it all set up.
Identifying electrode sites. The number of electrodes the patient will be wearing may vary from those shown. The center of the electrode should be within the areas indicated by the boxes. Because the patient may be wearing the electrodes for many days, skin preparation is extremely important. Before applying the electrode patches, follow steps 1 through 3 on how to prepare the patient's skin. Step 1. Choose areas of their chest that are flat and not very muscular. Avoid skin folds or creases, irritated skin, or scar tissue. Step 2. If necessary, shave hairy areas using the electrode as a guide for the size of the area to shave. This ensures good contact and makes electrode removal much easier. Step 3. If the patient has applied powder, lotion, sunblock, etc. to the chest, or has excessively oily skin, it may be necessary to wash each site with plain soap and water. Do not use a soap that contains lotion or oil.
Wearing 3 electrodes.
Applying the electrode patches. Using the patient cable, snap the white wire onto the electrode. Peel it from the plastic backing. And using this illustration as a guide, apply it to the patient's chest. Repeat the process for the other 2 wires. The same illustration is also in the patient guide booklet that came with the kit. Recommend that your patient change electrodes every 2 days, moving their location within the white boxes to prevent skin irritation.
Okay. Now I'm going to show you how to set up your monitor. This is where your battery door.
In order to continue the monitor hookup, you'll need to insert a battery. Please follow these steps when installing a new battery. The location of the battery compartment depends on the model of the monitor you have. Both models only operate on one AA alkaline battery. On the side location model, slide the latch in the direction of the embossed arrow to unlock the battery door. Tilt the monitor so that the old battery slides out. Insert the new battery using the label on the back as your guide. To close the battery door, ensure the latch remains in the out position. Close the door and push the latch back to the locked position. For the rear location model, slide the battery door in the direction of the embossed arrow to remove the battery. Use the ribbon attached if needed. Insert a new battery using the picture inside the compartment as your guide. Align the cover to the compartment and slide the door back into position. The unit will turn on and run through a series of self-checks. Then ask questions that require a yes or no response. Set up auto looper. Press yes for auto capture mode. If the doctor has prescribed a different mode as described in Section 2, press no to get to the correct mode. Then press yes to confirm. Time zone OK. Press no to get to the correct time zone. Then press yes to confirm. Pacemaker option off. If the patient does not have a pacemaker, press yes. Auto looper settings OK. Press Yes. If you haven't already done so, the screen will read, "Please insert patient cable." There are two types of patient cables depending on the model of Savi you are using. Both plug into the top connector in similar fashion. With the cable connected, the monitor will then check the placement of electrodes and provide any necessary corrective actions. Once the initial setup is complete, the Savi will automatically begin to monitor the patient's ECG, and the display should show "Monitoring" with the current date and time. Wait 1 minute and press the symptom button. The unit will beep.
I'm going to make a baseline recording of your heart.
When the recording is finished, the unit will beep again. The monitor will store an ECG strip that will be used as the baseline. Operating modes. Auto capture mode. As an auto capture device, the Savi continuously analyzes the ECG signal. When an abnormality is detected, the monitor automatically records and stores the event as an ECG strip. This may happen without the patient ever being aware of the cardiac event. Even with the auto capture feature running, the Savi still allows the patient to press the symptom button if they feel any related symptoms. Periodically, the Savi beeps and displays "Time to transmit," telling the patient the monitor has ECG data that needs to be transmitted to Medicomp's Cardiac Monitoring Center. Manual looping mode. In manual looper mode, the auto capture feature is turned off. The Savi stores ECG data only when the patient presses the symptom button. When the patient presses the symptom button, the unit beeps and displays "Patient cable recording" with a countdown. The monitor then stores the ECG before and after the patient pressed the symptom button. After recording is complete, the unit repeats the beep and displays, "To transmit, call 1-877-996-5553. We'll cover transmitting an ECG strip to Medicomp's Cardiac Monitoring Center later in Section 2, transmitting a baseline ECG. The optional finger electrode accessory is used when the patient cannot tolerate wearing the electrodes. It attaches to the connector on top of the Savi and is inserted in the same manner as the patient cable. The display is blank in the finger electrode mode until the symptom button is pressed. Once pressed, the display reads "Countdown to record," giving the patient time to moisten their fingers and place them on the finger electrodes. When the countdown is finished, the unit begins recording and displays "Finger electrodes recording." The Savi counts down to 0 and then displays "Transmit." Now that you've completed the patient hookup and understand the operating modes, it is time to transmit the patient baseline ECG strip to Medicomp's Cardiac Monitoring Center. If you used web enroll or faxed the patient enrollment to Medicomp, the patient's information will already be in the system. To transmit a baseline, call the CMC using the toll-free number 1-877-996-5553. Be prepared to provide the patient's name and tell the technician that this is a baseline strip.
Medicomp's Cardiac Monitoring Center, this is Christine. Oh, hi Jessica. You have a new patient? Okay. Peter Jones? Okay, I did receive the enrollment form. And just to verify, what was his medical record number? His medical records number is 191-53-7153. Okay, whenever you're ready, go ahead.
Once the technician tells you to transmit the ECG, stand the monitor, connector end up, on a flat surface near the telephone. Press and release the Yes button twice to begin transmitting the ECG strip. During transmission, the monitor emits a series of tones. Do not attempt to hold the monitor and/or phone while transmitting your strips. In order to ensure the best possible transmission, do not use a cordless phone or a cell phone. When the tones stop, transmission is complete, and it is safe to move the monitor. Pick up the phone and speak to the CMC technician.
Hi, did you receive the transmission? All right, I got it. Everything came through just fine. Thanks. Okay, thank you. Have a nice day.
But before you hang up the phone, you want to talk to the CMC technician to make sure that your transmission came through clearly and make sure there's no further instructions. Okay?
Right.
Once you hang up, replace the patient cable.
Cardiac monitoring center. I'm just going to plug your monitor back.
Remind the patient that they will be transmitting their ECG strips to the cardiac monitoring center after they press the symptom button, or when the monitor beeps and reminds them to
You'll
transmit.
be wearing this monitor 24 hours a day.
Okay.
Okay? And you are all set to go. Here's your belt clip. You can attach it to your belt.
Okay.
Remind the patient, once their procedure is complete, to transmit any ECG data that might be in the monitor. Then put the monitor, along with any unused batteries and electrodes, back into the SAVI kit, and place the kit into the prepaid envelope contained in the SAVI kit. Seal the envelope and drop it in any U.S. mailbox. Complete instructions are covered in the SAVI Patient Guide DVD and booklet. Section 3. Accessing patient data and retrieving patient reports on the computer. To retrieve patient reports from the web, go to Medicomp's homepage at www.medicompinc.com and click the Arrhythmia Access login icon on the left. Fill in your username and password and click Login. The Welcome to the Arrhythmia Access portal page will come up and advise you of any updates or alerts. Clicking on Reports, then on Event, will give you access to your patient's reports. Throughout the procedure, reports will be available for review.